Hello and welcome to my channel. In this lecture we'll be talking about the flexor compartment of the leg, so let's begin. The flexor compartment, or the posterior compartment of the leg, is divided as you learned before by the deep fascia, the deep transverse fascia, into superficial and deep groups. The superficial group has the gastrocnemius, the soleus, and plantaris in it, and the rest of the muscles are in the deep group. There is further division isolating the tibialis posterior, which is the transverse aponeurosis, attached to the fibular medial crest. Remember that between the medial crest and the tibia, it isolates in its own compartment the tibialis posterior. We will get to that. The gastrocnemius muscle, as you can see here, it has two legs. It has two heads. The medial head from the medial femoral condyle, the lateral head from the lateral femoral condyle, and the lateral supracondylar line. They both meet in an anterior aponeurosis. You'll not see the aponeurosis posteriorly; it's anteriorly. If you flip the muscle, it's an aponeurosis on its anterior surface, with aponeurosis on the posterior surface of soleus, which is deep to the gastrocnemius, so to allow for smooth gliding of both muscles on each other. Okay, got that? The aponeurosis will taper down into the Achilles tendon or the tendiocalcaneus to the back of the calcaneus. Okay, the medial head, as you observe here, as you noticed here, it's slightly lower than the lateral head. The small saphenous vein and the sural nerve are outside the fascia on the muscle posteriorly. On its way, the saphenous vein on its way to the popliteal vein in the popliteal fossa, and the action of the muscle, where you may wonder why we have two muscles here, the soleus and the gastrocnemius. The gastrocnemius is two-headed. The soleus is multipennate muscle. Multipennation gives prolonged strong action, while the heads gives forceful contraction. So actually the gastrocnemius, of course both muscles contract in walking, but gastrocnemius contracts more in forceful situations like jumping, like running, like that. The gastrocnemius. The nerve supply is the tibial nerve. All the nerve supply of the flexor compartment is from the tibial nerve. The soleus muscle, which is anterior to the gastrocnemius or deep to the gastrocnemius, arises from the head and proximal fourth quarter of the fibula, the soleal line, as you can see here, middle third of the medial border of the tibia, and the aponeurotic arch. There's an arch to cover the gap between the fibula and tibia, between the soleal line and the fibular origin. Anterior to this arch is the tibial nerve and vessels. The tendon forms an aponeurosis on the posterior surface of the muscle, in this case, and joins the gastrocnemius and the calcaneal tendon. Now, to talk about the tendon calcaneus, it's a spiral fibers, tendinous fibers, about 15 centimeter long, spirals medially. Okay, to act like a spring, to store energy, and gives an elastic recoil and elongation that will help us, raising the foot off the ground, especially, walking, running, and such. It's a great help to elevate the foot off the ground. It's a multipennate muscle for prolonged and strong contraction, as mentioned earlier. And the action is plantar flexion, and it's in continuous contraction during standing. If you stand still and observe your body, it will swing front and back, because of the alternating actions of the muscle spindles in your muscles. The muscle that corrects the body from falling forwards is the soleus. Okay? Is the soleus muscle. The nerve supply is by the tibial nerve. The plantaris muscle is a rudimentary muscle. In lower animals, it was attached to the plantar aponeurosis, but it inserts in the back of calcaneum. Arises from the lateral supracondylar line. It's a small muscle. It's almost all of it is a tendon that lies between the gastrocnemius and soleus. So in practical exams, there is no structures other than the tendon of plantaris between the gastrocnemius and soleus. Don't think it's a nerve, for example. Okay? It's the tendon of the plantaris. The action is a rudimentary muscle, as mentioned. It was attached to the plantar aponeurosis. Nerve supply is by the tibial nerve. Of course, this tiny muscle cannot assist in the plantar flexion of the foot. Now, the deep group of muscles. The deep transverse fascia attaches to posterior border of fibula and medial border of tibia, separating the superficial from the deep group. The deep group, the first muscle is Popliteus muscle. The Popliteus muscle, as you can see here, okay, this is the fibula, this is the back of the left knee, this is the fibula, and this is the tibia here. This is medial, this is lateral, and this is the popliteal artery. The popliteus, as you can see here, above from the area above the soleal line, because this is the soleus, and pierces the back of the capsule of the knee joint, guarded by the arcuate ligament. Remember that. It grooves the lateral aspect of the lateral meniscus and passes deep to the fibular ligament at the biceps femoris tendon. Covered by fascia posteriorly, almost all derived from the tendon of the semimembranosus muscle. The action, okay, it acts on both bones, the femur and tibia. You can say lateral rotation of femur on the tibia, which is unlocking of the knee, or you can say medial rotation of the tibia on the femur, which is also unlocking. It's the same movement, unlocking of the knee, because locking of the knee involves medial rotation of femur on tibia. Remember the locking mechanism of the knee, the one we talked about in the knee lecture. The nerve supply is tibial nerve. This is the popliteus muscle. Okay, remember along the upper border there was the inferior medial genicular artery. Remember? Okay, this is it. The lower medial genicular artery. The flexor hallucis longus muscle. This is the flexor hallucis longus muscle, arises from the distal 2/3 of posterior surface of fibula, as you can see here. Fascia on the tibialis posterior also, and the interosseous membrane. The tendon grooves the posterior surface of talus. This is in practical exams. Grooves the posterior surface of talus and inferior aspect of sustentaculum tilli, which is part of the calcaneus, the shelf extending medially from the calcaneus. So remember, it grooves the posterior surface of talus and the inferior aspect of sustentaculum tilli, because there is another muscle that grooves the medial aspect of sustentaculum tilli. Okay? Tendon crosses superior to flexor digitorum longus or deeper to flexor digitorum longus tendon in the sole of foot, And as it passes superior to the tendon, it gives two slips to the second and third toe slips of the flexor digitorum longus tendons. So they connect with the tendons for second and third toes of the flexor digitorum longus. You will understand this when we discuss the arches of the foot. The arches of the foot. This to support the medial longitudinal arch of the foot. Now, the tendon passes between the two sesamoid bones of flexor hallucis brevis. We'll study this in the foot. Then inserts into the base of the distal phalanx of the big toe. Of course, from its name, flexor hallucis longus, it flexes the hallux or the big toe, and of course plantar flexion because it passes the axis behind the axis of the ankle joint. The nerve supply is the tibial nerve. The flexor digitorum longus the muscle, which is this one, the flexor digitorum longus, from the posterior surface of tibia, medial to tibialis posterior, distal to the soleal line, this is the soleal line, okay, and fascia on tibialis posterior. The tendon grooves the medial side of sustentaculum tili. Remember this, not the inferior aspect of sustentaculum tili. The medial side of sustentaculum tili passes below the flexor hallucis longus tendon and then receives slips from the flexor hallucis longus to tendons of second and third toes. Tendon receives the insertion of flexor accessorius or quadratus plantae, and it gives origin to the lumbricals. So the tendon of the flexor digitorum longus receives insertion of a muscle, quadratus plantae muscle, and gives origin to muscles, the lumbricals. And we will see this in the foot. Inserts in the base of the distal phalanges of the lateral four toes. Remember, the lateral four toes, after passing through the splitting or divarication of tendons of flexor digitorum brevis. The same arrangement happens in the forearm and hand, between the flexor digitorum superficialis and flexor digitorum profundus muscles of the forearm. The action when the foot is off the ground, the flexor digitorum longus flexes the digits freely. When the foot is on the ground, yes, it flexes the digits, but there's no room for flexion, so they will be, pressed against the ground. So this will increase the surface area of the foot for weight bearing area. It increases the weight bearing area of the foot. To tighten the grip on the ground. The nerve supply is by the tibial nerve. This is the the flexor digitorum longus. Tibialis posterior muscle from the fibula and tibia and the interosseous membrane. As I said before, it's isolated or overlapped by aponeurosis, attaches to the medial crest of the fibula, separating it from the flexor hallucis longus and digitorum longus muscles. The anterior tibial vessels pass between the heads of the tibialis posterior to become in the anterior compartment. The tendon grooves the back of the medial malleolus. Tendon of tibialis posterior grooves the back of the medial malleolus. So you can imagine the number of stations, practical stations in practical exams on the talus and the calcaneus alone, for the muscles grooving the bones. Inserts in the navicular tuberosity, but from it sends slips to all tarsal muscles except the talus, of course, because the talus is a superior bone, and to bases of second to fourth metatarsal bones. The action, it's on the medial side, so it's a powerful inverter and plantar flexor. Plantar flexor at the ankle joint, inverter at the foot joints, not the ankle. Nerve supply is the tibial nerve. Now the muscles, tendons, pass beneath the flexor retinaculum. We studied the extensor retinaculum. Attaches to medial malleolus and calcaneus and plantar aponeurosis on this side. It gives origin to the abductor hallucis muscle on the medial side of the foot, and structures passing under it from medial to lateral. Medial is anterior, lateral is posterior, as you can see here. Okay? Tibialis posterior, flexor digitorum longus, posterior tibial artery, posterior tibial vein, tibial nerve, and flexor hallucis longus. You should know the tendons or structures in, arranged from medial to lateral or lateral to medial, whatever, but you should know the arrangement of these structures passing underneath the flexor retinaculum. The synovial sheaths for the individual muscles, of course, for each tendon, and tibialis posterior synovial sheath is the most proximal. Okay, this is the tibialis posterior muscle. Now the ankle joint. The ankle joint, it's a synovial joint of the saddle type between the undersurface of the quadrangular area of the tibia and the lateral side of the medial malleolus and the medial side of the lateral malleolus. The malleoli on the sides of the talus and the tibia on the superior surface of the talus, they call it the trochlear surface of the talus. Okay? It's a synovial joint of the saddle type. The capsule is attached around the articular margins, thin anterior and posterior, to allow for smooth dorsiflexion and plantar flexion at the ankle joint. The synovial membrane lines the capsule and has an extension upwards between the tibia and fibula. It's a small recess projecting upwards between the tibia and fibula. The ligaments of the ankle, it has lateral and medial ligaments. Laterally, the anterior talofibular, okay? Posterior talofibular, this is the posterior talofibular. This is the anterior talofibular. The posterior talofibular, see, it's attached to the fibular fossa, the malleolar fossa on the postero-inferior aspect of the facet for articulation with the talus. So remember, the anterior talofibular, the posterior talofibular, and the calcaneofibular. Okay, these are the parts of the lateral ligament. The medial ligament is called the deltoid ligament. It has a superficial and deep parts. A superficial part, the one you see here, is the calcaneotibial or tibiocalcaneal ligament. It attaches also to the sustentaculum tilli of the calcaneus and the spring ligament attached to it. Okay, and the deep part of the ligament is anterior tibial-talar. It's hidden here, and posterior tibial-talar or talotibial ligament. See, this is the posterior tibial-talar ligament. So these are the ligaments of the medial and lateral sides of the ankle joint. Relations of the ankle joints, simply they are the structure anteriorly, they are the structures under the extensor retinaculum, and posteriorly on the medial side, structures under the flexor retinaculum, and laterally the peronei, longus, and brevis muscles, and of course in the middle is the tendon calcaneus. So these are the posterior relations, and the anterior relations. Remember, we had to study the structures passing under the extensor retinaculum in detail, in arranged, in proper arrangement under the extensor retinaculum. Okay. Remember, it was tibialis anterior, extensor hallucis longus, the artery, anterior tibial artery, and the vein, and the extensor digitorum longus and the peroneus tertius muscles. These are the structures passing under the extensor retinaculum anterior to the ankle joint. For the blood supply of the joint, there is the anastomosis around the ankle. Like we said studied in the last lecture, it's about two networks about the malleoli, around the malleoli, around the medial malleolus by the medial arteries, such as the anterior medial malleolar of anterior tibial, the medial tarsal of dorsalis pedis artery, the malleolar and calcaneal branches of posterior tibial, and branches of the medial plantar artery, one of two terminal branches of the posterior tibial. The network around the lateral malleolus by the anterior lateral malleolar of the anterior tibial, lateral tarsal from the dorsalis pedis artery, perforating and calcaneal branches of the peroneal artery, branch of posterior tibial artery, and the lateral plantar artery, one of two terminal branches of the posterior tibial artery. Okay, so it's an extensive supply of blood around the ankle joint. Now, movements that occur at the ankle joint are dorsiflexion and plantar flexion. Remember, don't make the mistake of counting eversion and inversion as well. No, they occur in the tarsal joints, the eversion and inversion movements. More stable on dorsiflexion, because if you studied the talus, the body is wider anteriorly than posteriorly. So in dorsiflexion, the wider part of the body will come between the malleoli and further, pushes them laterally, okay, to the sides, and this makes the joint more stable. Then plantar flexion. You can experiment this. In plantar flexion, the ankle is loose. It's not tight. The ligaments are not taut. The blood supply by the anastomosis around the ankle joint, of course. The nerve supply mainly by the deep peroneal nerve and tibial nerves. The sprains occurring in the ankle more in the inversion, when the foot is inverted. This tears parts of the lateral ligament, and there is a fracture over eversion. This is nasty fracture, in which, see, this is the medial malleolus, this is the lateral malleolus. Over eversion, so this part of the bone is becoming more medial. This will make the lateral part of the talus compresses the lateral malleolus, which is weaker than the medial malleolus. So this will result in spiral fracture of the fibula of the lateral malleolus. When the fibula fractures, this will be more loose and the bone will descend more down medially, and this will cause avulsion of the medial malleolus, or transverse fracture of the medial malleolus. So there is a transverse fracture of the medial malleolus and oblique fracture of the lateral malleolus. In this nasty fracture, the falling on an everted foot. Okay? So this concludes our talk about the posterior compartment of the leg. I hope you got the maximum benefit from this lecture, and thank you very much for watching.